Come in.
Hi, Barb.
Hi, Stephanie.
How are you, honey?
I'm doing fine.
1 week post-op. How's everything?
It's great.
How you feel?
So far, so good.
Yeah.
The first week was a little rough. You know, there's some swelling and bruising, but I'm on day 7 now, and I'm feeling much better now.
Good.
I really feel a lot better. I feel like my old self again.
Good.
And I love the way it looks. I'm really,
You look
really happy.
amazing. Everything looks great.
Yeah.
When did you go back to work?
I actually took 4 days off, and I needed to get back. I have a busy job, but I would really recommend taking the full 7 days. If you can take 7 days, 10 days, to really pamper yourself and relax and take care of yourself. You know.
Good.
Because it really was day 7 that I was really starting to feel like feeling better again. You know?
Great.
Yeah.
Great. Then that's
Yeah.
typical.
Yeah.
That's typical.
The bruising and the swelling was minimal. I mean, the swelling was there, but the bruising was minimal. I had it mostly I had a little bit on this side,
Let's see.
and then I had some on my neck.
Yeah.
And so I just started wearing a scarf, which covered that.
Great.
But it's dissipating now, so I was pleased with that.
Yeah, and that's all
Yeah.
normal too.
Yeah.
It's usually below the neckline, so you can hide it.
Yeah, and I still feel the swelling, but obviously that's going to come down.
That's going to
Yeah.
subside probably
Yeah.
within the next week.
So
far,
so 1 more week, then it's going to subside even more.
yes.
Yeah.
Yep. Especially right up around here
Yeah.
in this region.
Yeah.
Everything looks great so
Yeah.
far. I mean, you're right on track as far as healing goes, which is amazing.
So-
I see
I'm
the
so
big
glad.
smile on your face,
Yeah,
which makes
yeah.
me very happy. Dr. Lyons is going to be ecstatic to see you next week for your 2-week post-op.
Yeah.
As far as your expectations being met thus far,
I would say right on track, if not exceeded.
great.
Dr. Lyons does a very professional job, and I'm very pleased with what he did. The office is great. It's very comfortable here. Staff is good. So I'm very pleased.
Good,
Yeah.
good. I'm really
Yeah.
happy. I'm
Yeah.
very, very happy for you. I
Yeah.
mean, you look amazing.
Thank you.
Already, and you're only 1 week,
Thank you.
so it's just going to get better from here. How did you decide to go with Dr. Lyons, by the way?
I was ready. I'd been thinking about this for a long time.
Yeah.
And I was really ready to do it. And then I was it was the right timing. A friend of mine referred me to Dr. Lyons' office. And I came in and I felt just comfortable, you know, you know.
Makes you feel at ease.
Yeah, so I said,
Yeah.
this is it, and I'm going to do it, and I did it. I made a decision right away. As you know, I decided within, I think I got back to you the week after.
Yeah.
Decided right
Yeah, we
away.
booked you within 1
Yeah,
week.
yeah, so everything sort of fell into place.
Just
The
flowed.
stars aligned.
Good, good. And do you feel you've taken the years off your face you wanted to?
I certainly do. I don't feel aged, I don't feel old, and I feel that I've gotten some of my youth back.
I feel like you have a permanent smile on.
I don't feel like I have to keep checking myself in the mirror and say fixing this or fixing that. You know, I just feel sort of natural and fresh, and both mentally and physically I feel great.
Good,
Yeah, so that's what it did for me.
good. And if you had any advice to any future patients, prospective patients, what would you say from the patient perspective?
I would say follow your instructions. You give verbal instructions and you give a written instruction. So I'd say follow them to the letter. Really pay attention, take care of yourself, pamper yourself for that first 7 to 10 days if you can. It's
Okay.
important.
I'm going to show you your before pictures.
Okay.
Okay?
Okay.
I'm going to give you this mirror.
Hi.
I'm going to let you hold that.
Okay. I know. Oh my goodness. Yes, 20 years, right?
So yeah, it looks
Yeah,
great.
so
Very
it's,
natural.
That's what I really like about it. It's just not a tight look or stretched look. It's just natural. That's what we talked about, and that's what Dr. Lyons gave me. So
He emphasized how he...
I don't want to look like I'm 19. I wanted to look my age, but better.
But
fresher.
refreshed.
Yeah,
Refreshed.
yeah, yeah,
You did it.
yeah.
During the procedure, you were very relaxed, nice and calm. How did
Yeah.
you feel?
I was very comfortable.
Good.
I was sort of aware of what was going on. I just felt very comfortable.
Safe.
I was very safe and relaxed with him and the whole team that was there. So, yeah.
But you were out of it. You felt
I didn't feel any
comfortable.
pain. There was no pain. There was no discomfort. But there was sort of a subconscious awareness of what was going on. But yet I was really very relaxed and in a very comfortable zone.
Which is awesome.
Yeah.
That's
Yeah.
very relieving to
Yeah.
feel that you're in
Yeah.
trusted hands.
Yeah. Yeah.
I'm just going to take a look at your
Yeah.
incisions.
Okay. This is really the only part of the whole process that was really uncomfortable. I mean, the swelling I sort of was expecting, but it was the sutures
turn it that way.
that are uncomfortable. If you're trying to sleep on an ear, you know, it gets a little uncomfortable. But
You're healing beautifully.
oh, good. I'm so glad.
You're right on track. I'm just going to check the other side and have you turn just like that. Beautiful. You're right on track.
Hey.
Everything looks gorgeous. These sutures are all going to come out by themselves.
They're starting to. I'm seeing that they're starting to pull and.
Yep, and they're absorbable, so they come out on their own.
Great. Okay.
As they come out, that's great. When you follow up with Dr. Lyons next week, any residual sutures I will remove for you.
Okay, great.
Okay?
Okay.
So next week we're going to follow up with Dr. Lyons for your 2-week post-op,
Okay.
and then we're going to go from there.
Okay.
Okay?
All right.
I'm
Thank
so
you,
glad you're
Stephanie.
so happy.
Yeah,
I'm going
me
to
too.
walk outside and have Patrick schedule you.
Okay, great.